you and I obviously have worked together a long time working on reproductive health and reproductive justice issues. And I know that, folks need to understand the work that Planned Parenthood advocates for, and Planned Parenthood advocates advocate for as a healthcare provider. And obviously our healthcare providers are our frontline workers right now during this COVID-19 crisis. What sort of response has Planned Parenthood generated to the COVID-19 pandemic, and what sort of helpful resources can we provide to Oregonians?
Yeah, thank you. It is such an interesting time right now. So much has changed so rapidly. And to your point about the kids, like, we do need to all take really deep breaths and think about what are the needs of our individual communities, our families, and what can we do to help? And that has been the approach that Planned Parenthood is taking. First of all, I just want to say that everybody who watches this video should go and follow Planned Parenthood Columbia Willamette if you're in the northern part of the state or in Bend, and go follow Planned Parenthood Southwestern Oregon if you're in the southern part of the Rogue Valley, Eugene area. We are putting out updates every day. Our amazing healthcare affiliates are saying when they're open, how you can schedule an appointment, and what kind of services you can get. Just as an example, Planned Parenthood Columbia Willamette is providing drive-up Depo-Provera injections,
Wow.
So allowing patients to remain in their cars and still get care. It's
Birth
pretty
control.
amazing. And yeah, birth control. As per our previous conversation, you can still access birth control even in a global pandemic.
Yes.
This is critical. So our family planning services are still really going. And so the first thing that our health centers and the amazing leadership at our health centers did to respond to this was say, how can we help? And one of the things that we knew we needed to do was to contribute to flattening the curve and being a part of the public health response. So we embraced telemedicine, and we had already been providing telemedicine services already. I bet you tons of folks watching this are like, yeah, I've done a video with my Planned Parenthood provider, or I've been on the phone, or they've helped me get access, mailing things. So our folks are doing what the state is doing and saying, like, we all need to be distancing ourselves physically and providing care whenever we can via telemedicine, and then letting the folks who need the most care most immediately go in person to the health centers. And we know that we're contributing by, if you're having, our health centers are like, if you're having really severe pain or bleeding, like, you should still be reaching out and coming into the health centers, and you'll get taken care of. So we've done a lot of things, and I would highlight that, PPCW donated 1,500 swabs, for example, to OHSU so they could continue to provide COVID testing. So we've been partnering with other parts of healthcare to say, how do we help folks who need care but don't need to go to an emergency room or don't need to go to a hospital access the care that they normally would, because reproductive health care and sexual health care doesn't stop. We all still need that even in the midst of this pandemic, but we're trying to do things in our part of the world where we're contributing to limiting the spread of COVID-19, but also just making sure people can access the services that they need.